is what happened, and that is what happened when a patient has a heart attack. The blood vessel, one of that plaque will just block the blood vessel, and the patient will present with heart attack. Okay.
This is serious, Daktari. But what are some of the symptoms then that we can look forward to our family, anyone who's around us, ourselves?
Yes, of course, as I'm going to mention, interestingly, the symptoms of heart disease tend to be very much like many other things that we feel. And even when I come to a place like this and I want to mention heart disease, from the following week, I start getting a lot of calls from patients that I'm having palpitations, am I having heart disease? I'm having some chest pain, am I having heart disease? So yes, the symptoms are there, but we would want as much as possible to avoid them. Don't wait for these symptoms to come. And of course, every symptoms that you hear, don't panic. It's always good to share with your doctor. So these symptoms will include shortness of breath. Actually, shortness of breath is the commonest symptom. Before you are able to run 100 meters or even climbing 2-3 stairs, then you find yourself, you cannot do that. Every time you try to climb the stairs as you used to, you are getting tired, more tired than before. Shortness of breath is the commonest. The other one, of course, is chest pain. Again, chest pain which tend to get worse as you walk or as you exercise. Palpitation, that is, you start sensing your heart. I do know a lot of young people, they get anxious, they are not having sleep, so they tend to sense their heart. That's not what we are discussing here. But yes, if you have a heart disease, you get palpitations, but these palpitations will come together with other symptoms like shortness of breath or chest pain. Of course, leg swelling. I mean, once the heart starts getting fatigued, patients will notice some leg swelling, including, of course, cough. Cough is very common. During this era of COVID, actually, there is a lot of confusion between COVID and heart disease.
Yeah.
Because COVID patient will have a cough,
will also have shortness of breath.
They will have shortness of breath.
Yes.
Actually, even in our hospitals, as we practice, we are very careful. When any patient who is coming to us, heart disease, we have to be careful that it's not COVID. So yes, these symptoms are very much similar even to a pneumonia or even similar to other things, but it's very important for when a patient has this kind of symptoms, please share them with your healthcare workers.
Yes. Absolutely, look through them. And also now as we talk about diabetes, what are some of the symptoms of diabetes?
Thank you very much. Again, this is a very important question.
Yes.
Diabetes has the so-called cardinal symptoms. And I'll go through it and then I'll explain later on a little bit more. The cardinal symptoms for diabetes are increased thirst, wanting to drink water, drinking a lot. And sometimes what happens, you get so thirsty and you think my thirst can only be quenched by a Coke or Fanta or Sprite.
Because water is not doing the job.
Because water is not doing the job.
Wow.
So you look for a cold Coke, then it gets worse.
Oh no.
Because the sugar goes up. So those are two, drinking a lot of water and thirst, and then that water you have to urinate because the sugar will have to get out.
Yes.
So you urinate a lot. And the way to know is that sometimes if you occasionally at night you wake up one time, and for a week you're waking up 2 times, 3 times.
So wait, are you saying regularly what's normal is 1 time a night?
No, there is your normal.
There's a normal.
I said you are normal.
Okay, so everyone has
your
a normal.
Your normal is 1.
I was just like, doctors, let's cut the show.
Your normal is 1. Then you start seeing it's increasing.
Okay.
And you know there's a problem.
Understood.
And then, other than that, you get tiredness. Sometimes you feel, after eating supper, you just want to lie on the couch and sleep on the couch. And if you're married, your spouse is waking you up to go to bed. It was not usual. Or even after lunch, when you're driving, you feel like you want to nap on the traffic jam. That's not, if it has not been usual, then that's a problem. Because when you eat, the sugar goes up and your body becomes lazy. Over time, you'll start losing weight. You find weight is coming down and you don't know how, and maybe again, people close to you, they tell you, no, there's something's wrong here. You have to go to hospital. Sometimes, to the ladies, they may start getting vaginal itch and a vaginal thrush that's not going away, and again, that's a sign of diabetes. The other issue is that you're wearing glasses and you have been corrected, and then you find, yesterday I was seeing well, but now I can't see.
Your prescription is getting worse.
Yeah, I can't see the TV very well. And then you find, in the morning I was seeing well. You know, that variation in visual, in vision is also an indication that diabetes may be there. But unfortunately for some of us, for some of our friends or family friends in upcountry, diabetes may come a bit more dramatically than that. A grandmother will go to the shamba, get a thorn prick, then get an infection. The infection day 1, there is a little pus. The infection day 2, the whole leg is infected. Day 3, the infection, the leg has turned black. What Dr. Victoria is saying, vascular problem, and is going to go to hospital. They told you have to be amputated, and then they test the sugar. Voila, the sugar is there.
Yeah.
So and that to me is very unfortunate in our situation, because it's pretty common that people get amputated the first time they're knowing they have diabetes. It's for a long time, diabetes was the single most cause of amputation other than accidents.
Wow.
So those are in children. In children, they will have similar symptoms, but sometimes children don't talk. So the nappy rash, if it's persistent, may lead the mothers, should make mothers get concerned, because the child will not say, and because the child is urinating a lot and the urine has a lot of sugar, so the yeast will grow around the groin when the nappy is put. The child will also become, the growth curve will change. Those who have children know the growth curve, the one that are in the antenatal clinic, you find is going down, but the child is eating pretty well. So again, that will be an indication of, but sometimes children may present again in coma, because they get that problem I told you, because they don't have insulin. They get into this sort of deep breathing, then they're hungering for air, and then eventually they go into coma. Sometimes, in the years gone by, when the testing was not very good, those children used to be diagnosed with cerebral malaria, and they would eventually die.
Oh no, because they're being treated for...
Because something very different.
Yeah.
The diagnosis was wrong. So it's a bit tricky, but I think generally, in short, I think that those will be the symptoms.
I'm just curious, just to go off the questions, when do you refer a patient to Daktari, and when does he refer a patient to you? I think I start with you, Dr. Bernard.
Yeah, that is true. Yes, as the most important thing, all doctors from medical school, they are trained to manage some bit of cardiovascular disease or heart-related disease, including diabetes. So the expectation is that from primary care physician to the physician, they should be able to manage these conditions. However, of course, as we specialize, some will be more focused on the heart. Other colleagues, like my colleague here, will be focused on diabetes. So what tends to happen, of course, when we are managing our patient is in my docket, of course, I'm managing hypertension, and that patient tends to be diabetes. We try as much as possible to share or seek opinion of our colleagues as specialists, so that we assure, even if I'm managing that patient with the diabetes, I would like to be sure that that patient has early touch or early encounter with an endocrinologist.
Okay.
So that, of course, there are other things that I could easily miss. So, of course, there are those situations that the sugars are not well controlled. I'm managing a patient, but the sugars are not well controlled. I'm using one medicine, it's still not working. Again, I would refer. So the situation of reference, of course, we tend to, when the sugars are not being controlled, and also as early as possible, we would like to seek the opinion, just to make sure that you are doing the right thing.
Okay.
Yes.
22232 is that text line. Keep your questions coming. This show, I'm telling you, Daktari, as we get to the end is when messages start coming in, and they're still coming in. Continue. We'll be asking all your questions to our cardiologist in studio and our our diabetician. Is that the word? Is that another word? What is it? What was the other word for endocrinology? Is there another word for endocrinologist?
Not really. Endocrinologist is an endocrinologist. That's what it is.
Okay, fine. So our endocrinologist as well in studio. So go ahead and ask all those questions you might be wondering about cardiovascular diseases, diabetes, and now that we know these two have a very, very close relation as we go. So you've explained type 2, type 1 diabetes, but the question is, how is diabetes diagnosed?
Thank you very much. Another very nice question. If we go, I'll go back in history, a long time ago. Diabetes used to be diagnosed by testing urine.
Okay.
So, and that came after somebody, an Indian doctor, found that somebody were peeing, then there were a lot of, is it bees or something like that?
Around, okay. The sugar,
then,
wow.
they found that you have a disease that you didn't taste sugar, and you are wasting away and you're dying. Of course, there's been a lot of development, and we know the values that you need to test. So we do blood tests. Even in my training days, we used to check urine, but not to taste. We used to have something called dipstick that used to, when you put it in, they change color, and somebody has sugar. But nowadays, with technology of gadgets, we call glucometers, that are easily accessible, and I'm glad to inform that there are some nice companies in this country that give the glucometers free of charge.
Wow.
And then you buy the glucometer strips, which is quite a boost for our patients. Now, to diagnose diabetes, you must, when you test your sugar before breakfast in the morning, it must be above 7.1.
Okay.
Then you say somebody has diabetes. If you have eaten, if let's say you come to my clinic randomly and you say, Doctor, can you test my sugar? And I find your sugar is above 11.1, then that's a diagnosis of diabetes.
Okay.
Of course, sometimes people will not believe they have diabetes with one reading, so they would want a confirmation. So you could do another one. Sometimes when in doubt, let's say like a sugar between 6 and 7, a few times, it's higher than normal. And you want to diagnose, there's a test we call OGTT. It means you are given sugar, a lot of sugar, 75 grams of sugar. You take it in water. Of course, it's like a drink, very sugary drink. Then your sugar is tested every half an hour for 2 hours. Okay. If your sugar at the 2-hour time is 11.1 and above, that is a conclusive test for diagnosis. So that's how you diagnose diabetes. I must say that it's also important because we have another situation in diabetes called gestation diabetes that afflicts mothers when they're pregnant. And routinely worldwide, it's common now that mothers, when they're pregnant, they must be tested for sugar. Why? Because if you have diabetes and when your sugar is not very high and you don't have symptoms, the baby may be affected. The babies are big. The outcome may be bad because the baby is big and it doesn't mature well. And especially if you have a family history of diabetes, you must, after the age of 30, volunteer yourself to be tested for sugar routinely, maybe once a year, so that you diagnose it early and you start acting on it early. Okay. If you are a young lady and you're married and you're going to have your baby and your mother has diabetes, it is important to tell the doctor that, so that they will...
It's a history.
It's a history, and it's important when you're pregnant for them to test for sugar more aggressively than they have done otherwise. Yeah.
I have a question. Just in my rough thinking of what I know about diabetes and high sugar, there are people who have high sugar and people who have low sugar. Is that what you're trying to explain with?
No.
Just to take you back.
Now, low sugar. Now, it's important to say about low sugar. I think the low sugar, which the ordinary viewer may have heard about, sometimes the low sugar is commonly found in people who have diabetes, but they are on medication. The medication causes low sugar.
So someone runs and gives them a Fanta?
Yes, the medication has caused a low sugar. Okay. And that is important you have brought it up. Yes. Because it's a simple thing, but it can also be very dangerous. Because if you take medicine in the morning, and for one reason, you miss lunch, or you miss your snack, but more so you miss lunch because you're on a journey or you're in a meeting, and the sugar drops, and you're in a place where people don't know what to do, you could easily get brain damage.
Wow. That's serious.
It is serious. So it is important for people with diabetes, again, to eat well. So they get low sugar because of drugs. Okay. Drugs and not eating on time. I always say, if you have diabetes, you do not prepare food because you're hungry. You eat when you're hungry, not start cooking ugari because you're hungry. Ugari should have been ready before you're hungry.
Okay, so you don't wait for the extreme time.
Yes.
Okay.
And I must add, there's another reason for low sugar, that may occur when you don't have diabetes. That is, if you have some tumors of the pancreas that produce excessive insulin. But this presents in a different way, is that you do not have diabetes, but you wake up always very hungry, shaking, sweating, and when you take breakfast, you feel you're okay. And find yourself ballooning, putting on a lot of weight because you're eating too much. And when you go and have a scan, and you'll be found to have what we call insulinomas, small tumors in the pancreas that produce insulin.
our bodies are really, really strange. I'm sure you have a lot of snacks in your office for someone who will come in and maybe, I don't know, we'll find out. Let's look at treating and managing heart disease for a person with diabetes. And we're coming through to your questions. Thank you so much. Keep them coming. I'll start asking the questions right after we respond to treating, managing heart disease, and especially for a person with diabetes.
Yes, I would like to say when we are managing diabetes, we like to look at them in total, at the whole. We don't want just to look at the sugars alone or the heart alone. That is why we work very closely, of course, with the endocrinologist. So there is what we call the ABCs or ABCDs of managing patients with diabetes. Heart disease and diabetes. Because when you don't manage diabetic well, then you are likely to go into, or your heart to get damaged. So we ensure when we are managing this patient, their sugars are very well controlled. There is a parameter called HbA1c, which of course the endocrinologists we like to do every 3 months to see how good the sugar control is. So we want to ensure the sugars are very well controlled. That stands for A. And of course, A also there can, we also include activities. We want to ensure patients who have diabetes, who have heart disease, are exercising. They are remaining active. That's very important.
Okay.
And for B, blood pressure is always very important. Patients with diabetes will take blood pressure very seriously. We have targets for a normal patient who is not diabetes. But for that who is diabetes, the target for blood pressure must be very good. So we ensure that they are using their medicines very well. C stands for cholesterol, or these fats that we are talking about. A patient with heart disease, diabetes, the cholesterols have to be, again, very well managed. And we have medicines called statins, which lowers cholesterol. And of course, including diet, also will support the cholesterols. Of course, the S, the ABCs, stand for smoking. Patients who are diabetes or have heart disease, we always talk about smoking. If you have been a smoker, we must discuss. And we always like to discuss this. We know stopping smoking is not easy. And therefore, every clinic in the follow-up, we want to rediscuss it again, to support our patients to be able to stop smoking. And of course, for D, we normally would be studying for the diet. We talked about the diet. It's very important. We need to keep talking about the diet. So basically, we look at all those things. And you remember we talked about the risk factors. So we like to manage these risk factors together with the diabetes, together, of course, with other medicines for the heart. And that's how we manage our patients.
Okay, that's very, very important. It's a ABCDS.
ABCDS.
Okay, A again, one more time.
A is for activity. And the HbA1c. A1c. Okay. A1c is, it normally checks how good the control of sugar is. B, we talked about blood pressure. It's very important. C is for cholesterol. S is for smoking.
Yes, and the D is for diet.
Discuss diet all the time.
How about you just never start smoking if you haven't? It's a good idea. Think about it. Even as you do that, there's a question here as you continue. I am diabetic and hypertension with hyperobesity. I'm currently under medication. I think this one is asking more so for referrals to help shed off the weight.
All right. That's a nice question because it's challenging many diabetic patients.
Yes.
One, diabetes itself, the precursor would be obesity. And when the control is bad and use insulin a lot, you get bigger. It's a catch-22. Now, there are many ways that currently there will be the pharmacotherapeutic or the medicine that you could use. One is to try and use drugs that do not make you gain weight if you have diabetes. You've discussed with your diabetologist, and I mentioned a few. There are drugs that are weight neutral, and there are drugs that cause weight gain. The drugs that are weight neutral will be a drug called metformin and others called DPP-4s. Those are big names. So you can discuss with your doctor. Then there are drugs that will help you lose weight. Those are the new drugs, and I think we discussed it with you in the opening.
Yes.
There are 2 drugs in the market. Again, I'm not holding brief for any company.
Yes.
But the broader name is called SGLT2.
Okay.
They help you to lose up to 9 kilograms.
Wow.
Then there are other drugs called incretins. Again, we have them in the market. These are injectables. They help control the sugar as well, and they help lose weight. That's the medical. I must say, these drugs are not cheap.
Yes.
They're pretty expensive. So if you are not to have a good insurance cover, you may find yourself straining. Then there is what we know now, that there is a surgical treatment for hyperobesity. That is, if your BMI is above that, I'll explain what a BMI is. A BMI is your weight divided by your height squared. That gives you a BMI. If your BMI is over 35, you are super obese. And some people's BMI will go up to 50. What we know now is that if you do what's called bariatric surgery, which you go in and chop off the stomach, or
is it like a tummy tuck?
No. Tummy tuck is for just a six-pack.
Wow, this is like next level.
This one like going inside the abdomen and cutting the stomach. Tummy tuck is just the fat on the skin. Tummy tuck is just a cosmetic. It has nothing.
Okay.
It has no.
So this one reduces the size of the stomach.
Yes, so that when you eat very little amount of food.
Oh yeah, there's another word they've been using for it. But
it's called bariatric surgery.
Okay.
There are many ways. You can cut the stomach. You can do bypass. You can do
gastric bypass.
Yes, you can do budding. But the whole thing is called bariatric.
Okay.
And what we know is that when it's done well, sometimes you can even reverse your diabetes and you'll be like not having diabetes.
Wow.
Again, it's not affordable to everybody.
Yes.
Most people who have done it here, you have to go to India to have it done. So it's a challenge dealing with overweight in diabetes. In this country, in the US, in the UK, it's a big challenge.
Yeah. But could I also recommend a nutritionist, maybe one of our very own nutritionists who comes for health check from Viringo Wellness, Christine? You can just check out Viringo Wellness. Do you have another nutritionist that you work closely with?
No, we work with nutritionists.
Yes.
I mentioned that because you used the word hyperobesity.
That's good.
I would mention the nutrition that has been used is something we call VCD, VLCD, very low calorie diet.
Very low calorie diet. Okay.
And you find, again, since we are in the diet, there has been a lot of talk in this market or in this country about, people and girls of your age are doing something called intermittent fasting. I don't know what intermittent fasting is. I have. The others who are doing keto diet.
Keto diet. There's something you mentioned, and I wanted to highlight about keto diet. When you said your body starts using fats, and I feel that's the process of the keto diet, to shock your body into using the fats instead of the carbs.
It tries to do that. But maybe that's a discussion, entirely
different.
But there are those people who try that. But I think one has in diabetes, one has to avoid reaching a situation whereby you're going to get into that adventures.
Yeah.
And that's why Dr. Gitura's issue of activity and diet needs to be emphasized every time you see a diabetes patient, somebody with heart disease, so that even from the beginning, they know you see, like there's something we call targets.
Yes.
Dr. Gitura mentioned about BP targets. And we have that for diabetes as well, and we have sugar targets. Which target is also important. But be gentle with your patients, because sometimes they may get depressed when they don't get good results.
That is so true. Dr. would you comment also on the same in terms of diet and weight and all that affects the cardiovascular system, as you tell us about how we can lower the chances of getting cardiovascular disease?
Yes, of course, the good thing, the good thing or what makes managing these patients, diabetes, cardiovascular, easy sometimes. What our patients need to do is the same. We are talking about the same. We are lifestyle, exercise, diet. When we engage in all these things, and that is why from the very beginning, how I would wish, in fact, we in our as Kenya Cardiac Society, we of course we are trying to see how do we reverse the clock. Right now we have a lot of patients with diabetes, with heart disease, but this patient we are catching them so late, and we are seeing the risk factors is obesity, which now is occurring in the youth, in adolescents. So we'd wish, probably we need to go backwards and look at our schools, look at our youth, and start addressing obesity, exercise, talking about those good things that should be happening. And they should start very early in our curriculum.
Yes.
We have children, we pack food for our children. What type of food do we pack? So if we were to address good diet from very early on, and of course continue to emphasize exercise, probably obesity, we need to reduce obesity from the schools and from the youth, and therefore we can reverse probably the trends in diabetes and the hypertension. So basically, what our patient need to do, we are saying, is really simple. It's not complicated. There are those few steps to manage yourselves, and those including remain active, physically active. If you are a smoker, please don't smoke, and if you have started, you stop smoking. The diet, we need to, of course, to increase our vegetables. Vegetables and fruits are very good, and reduce the sugars, as we have already discussed. But assuming you have these diseases, don't get depressed, because they are medicines. They are good medicines. For blood pressure, they are very good medicines. You just need to ensure you follow the advice of your doctor, manage your blood pressure properly, manage your sugar properly, manage your cholesterol properly, and you live a relatively normal life. So that is what I would say.
So that's how a person with diabetes can lower chances of having cardiovascular disease. Just to understand this clearly, diabetes would be the one that will be a build-up to a cardiovascular disease and not the opposite?
Yes.
Okay.
Many times, yeah.
Okay, many times.
Yeah.
As we look at that also, question, is cardiovascular diseases and all these diseases, are they curable?
A very good question, because that is what our patients keep asking us. Unfortunately, I would say 80% of cardiovascular diseases are preventable. And they are preventable by those things that we mentioned. They are preventable. But they are only preventable if we look at our lifestyle from very early onwards. Once the cardiovascular disease sets in, the majority are not curable. You can only manage. You can manage them. If it is blood pressure, we don't talk of. It's not going to be curable.
Yeah.
If we are talking about diabetes, you are not going to cure diabetes unless in those very rare instances that where the doctor mentioned. If you have a coronary artery disease, heart attack, it's not curable. So there are very few diseases in cardiovascular which you can actually say is curable. For instance, a patient can come with what you call heart block. Heart block or a rhythm is a problem. We do a pacemaker. When you do a pacemaker, you can actually say you have kind of cured, although the patient will not be taking medicine because they'll have a pacemaker. Or you have a rhythm problem, we go in and they do some ablation of those electrical pathways which are causing the palpitation. They are curable. So yes, cardiovascular diseases, majority are not curable. You can only manage them. But the good thing, they are preventable. Let's work towards preventing them.
Dr. Even as we continue with this, Christopher, who is calling in, thank you so much for calling as we plan to go for our first break. Christopher, good evening.
Yes, evening to you.
Thank you for calling on Hope TV and thank you for watching Health Check.
Yeah.
What is your question, sir? Christopher, can you hear me?
Yes, I can.
What is your question?
So I want to ask, I normally feel some pain in my chest, left chest, yeah?
And the left side of the chest,
Yes, and it comes and then it goes away. And sometimes I hear my heart pumping very, very, how do I put it? Very quickly.
So the rhythm changes, okay.
Yes. And I went to hospital some time back. I got my result of cholesterol, that part of triglyceride. It's called triglyceride, something like that. I know doctors will understand. So I wanted to know how I can do and how I can get healed.
Okay.
Yes.
Doctor, do you have any follow-up question? Any of you? With a follow-up question for him?
Yes. I think what I can mention, I think just as I said at the beginning, yes, the symptoms for cardiovascular disease, heart disease include chest pain, include palpitations. but at the same time, especially in the young people, they can still experience similar symptoms because of other issues. So I think for that patient, I would urge you not to panic. I think it's always good to discuss with the cardiologist the symptoms that you are feeling. Like he has mentioned the issue of triglycerides, and as far as we know, triglycerides usually they don't have. They don't have. Yes, they might be high, but they are not the cause of what the caller is feeling.
Okay.
So, but if he has not, if he has not been seen by a cardiologist, probably he can come to us. Then we can listen to the symptoms and probably be able to explain and see how to help the patient.
And what he explained about cholesterol? Something he's mentioned about him having cholesterol, but yes, it's important for you step in, go to the
cardiologist.
Yes, to the cardiologist.
To
yes,
be able to share. Yeah.
Very, very important. You can keep your calls coming. We're about to go on our very first break, but our question for you, Daktari, this treating and management of diabetes, very, very keen, very, very detailed.
All right, thank you very much. How do we treat diabetes and how do we manage diabetes? Very nice words. Some people would mix the two and think they are one and the same.
No.
They're different, actually. And I would like to say, we have agreed diabetes is sugar that is high. That's the primary. It is associated with high blood pressure. It's associated with high cholesterol. It's associated with, many times, obesity. So in managing of the diabetes, you're managing the patient in wholesome, in collaboration with the cardiologist and other stakeholders. You will treat diabetes basically when you're treating the sugar. And treatment of sugar is, there will be lifestyle where we explain to the patient that they need to do a minimum form of exercise. We are told between 150 and 200 minutes per week is a minimum. It's like 30 minutes every day.
Okay.
And this exercise, you don't have to jog like Usain Bolt. You can walk.
Yes, a power walk.
Yes, power walk. Even your grandmother's walk is still good exercise. So exercise is important for those who have the money to go to the gym. And we always say don't do 2 days back to back without exercise.
Okay.
Because some people will say I go to the gym the whole Saturday afternoon, so I do the 200 minutes on Saturday afternoon.
No.
That's not good enough.
Space it out.
Space it out.
Okay.
Then there is the issue of diet. And I would like to summarize diet because diet can be very complicated if you want it to be.
Absolutely.
But what we do recommend is that food that has sugar additives, you should avoid them as much as you can. Then the carbohydrates, restrict the portions.
Okay.
And your nutritionist will tell you the portion. They'll tell you a cup, a spoonful, a serving, all those things. Then remove the fat from the meat and eat it in moderation.
So lean, very, okay.
Yeah. And then fruits, again take fruits regularly, but the amount must be also be regulated. But you can eat a fruit in the morning, a fruit in the afternoon, a fruit in the evening. The meats, the white meats, is much better than the red meat. That's the diet and lifestyle. Now the medication usually starts a process whereby we say, when you meet your patient, you discuss with that patient the targets. You want fasting sugars to be below 7.
And fasting sugars,
It's
just to be clear.
sugar done in the morning before breakfast.
Okay.
Below 7. And that targets are important. And because you want these patients to be testing their sugars. And that's another important aspect of management of diabetes. That the patient becomes the doctor because they have the diabetes most of the time. So they are treating and they're managing the diabetes. So they should test their sugars in the morning before breakfast and after a meal, maybe dinner or supper. And then the target for after supper or after a meal should be sugars below 8.
Okay.
So when they write down those, they come with those numbers for the doctor. Of course, the patient had been put on some form of medication. Initially, for starters, we're supposed to use drugs that do not cause weight gain and do not cause what you asked about last time, low sugars, and drugs that will also control the sugars. So you must look for a drug that achieves that target as much as you can. Of course, drugs will fail. In fact, one drug will fail, and before you get very serious, you add another one. So sequentially, you're adding drugs to maintain the target. So the key, you are treating to maintain the target. Over time, the type 2, the tablets will fail, and you'll introduce insulin. Again, focusing on the target. The other aspect of management is monitoring for complications. And this, again, dear viewer, you must discuss with the doctor. Have your eyes been checked? Has your kidneys been checked regularly so that you are preempting the complication before they come? And if they do come, or they start coming, then there is treatment that again slows down the progression. So, and then when they do come, then you can treat them in a different way. The eyes will be treated by laser, kidneys will be treated either by dialysis and transplant when the time comes. So it's everything that you're doing. Drugs, managing your lifestyle, managing how you're living with that disease.
Just to highlight, that prick is really painful for testing. Someone pricked me recently. Hey, your sugar is good. Just taking on the family.
It is painful, but I think a doctor who is doing diabetes must teach their patients how to use that prick in a less painful way.
Yeah.
But sometimes people who are testing sugar put the highest gauge of that needle, so it goes deep inside and cause a lot of pain.
Yeah, can you give us a small prep, honestly? You're here with us. What do we need to do?
Usually the first thing is that the prick should not be here on the pulp.
That's why it was the most painful thing in the world.
Usually you should do it on the edges.
Okay, on the edges.
Because here there is concentration of nerves.
Okay.
So do it on the edges.
Okay.
And if the edges, like a client of mine who is blind and who reads Braille, one day nearly killed me because I was going to prick the fingertip.
Oh.
Before he had a problem of knowing how to test his sugars.
Yeah.
And he told me I cannot test with my fingertips
because that's what I used to read.
But then you can use also the palm here.
Okay.
You can use the palm, and it's less painful. It's less painful, especially in younger people, children, or even the sole of the feet. But use the lowest gauge.
Okay.
Gauge 1 or gauge 2 would suffice, will be less painful. When you go to 3 and 4, you are going to cause a lot of pain.
For our cardiovascular diseases, we said not curable, but extremely manageable. How can people prevent? These are just tips from you coming to each and every one. And just for someone who just joined us, what are some of these cardiovascular diseases?
Yes, cardiovascular disease, of course, there are many. I'll just mention a few. Anything which would affect the heart. Of course, the pathway for all diseases which affect the heart, the final pathway is more or less the same, whereby some patients will get heart failure. Heart failure is one of the conditions which would affect the heart, where the heart tends to become weak. And when the heart is weak, we call it heart failure. And the patient will come now with the leg swelling, they have shortness of breath, they have difficulty in breathing. So other situations like a heart attack. Heart attack is those situations whereby the plaque that we talked about and the cholesterol blocks the coronaries or the blood vessels. And when this happens, the heart muscle get injured, we call it heart attack. Of course, other diseases include the rhythm. The rhythm of the heart can change.
Yes.
You normally hear people talking about palpitations because the heart is actually controlled. There are some electrical pathways. So some of these rhythm disorders, and one of them is called atrial fibrillation, whereby the heart beats in a very irregular. It can beat very fast or very low, but in an irregular manner. So those are rhythm problems. We have other heart disease whereby the heartbeat can be very low, something we call heart block. So basically, heart diseases are many. And since we are talking about cardiovascular disease, and we said include diseases of blood vessels. And one of the diseases of the blood vessels which affect patients with diabetes is when the blood vessels of the foot can get blocked, and then now the patient gets peripheral artery disease. Peripheral artery disease is where now the blood vessels in the feet are blocked, and the patient are getting painful food, and it can lead even into gangrene and amputation. Of course, stroke. Stroke is still very important. It is part of cardiovascular disease. This is where a blood vessel in the brain blocks again because of a cholesterol problem, and that patient will get a stroke.
Dr.
So
can you just allow me to
diseases-
pick one call as you wrap up that?
Yes.
Okay, Michael from Gong, what is your question?
Thanks, no?
Hello, Michael. Thank you for watching Health Check.
Yes.
Please go on with your question.
Okay, I wanted to ask,
Yes.
is there any medicine for sweating? Because I'm diabetic,
Uh-huh.
and I usually sweat at night, mostly at night.
Okay.
Yes.
So he's
I don't
having
know.
heavy sweats at night.
Yes. And my sugars has I'll always be below 10.
Okay. At what time? Fasting sugar or the other one?
Fasting sugar, sometimes 4.
Mm-hmm.
But normally, they run between 6 and 7.
Okay.
Yes, but at
Can you
night,
repeat it for me?
Yes.
I usually sweat a lot.
Okay. Okay. Thank you so much. Even as you continue, Dr. please don't lose your train of thought. Dr. Bernard, don't lose your train of thought. We are still on you. But the question is to you, Dr. He's been having a lot of night sweats, and he's wondering what's happening. His sugars are good between 6 and 7 for fasting sugars, and at 10 sometimes. So is there anything that he can do about the very, very serious night sweats?
Does he have diabetes?
Yes, he does have diabetes.
All right. There are reasons that you can have serious sweating with diabetes. If you said his sugar is normal.
Yes.
But if your sugar is normal, the other reason that you can sweat is what we call autonomic neuropathy.
Autonomic neuropathy.
Yes.
Okay.
That's maybe a little bit more complicated, and specifically maybe I think he needs to see a diabetologist to have that assessed.
Mm-hmm.
But of course you can have night sweats for many other things.
Mm-hmm.
So occasionally people may have infections like TB,
Mm-hmm.
and before and TB is a slow disease,
Mm-hmm.
and that can make people sweat a lot at night.
Okay.
So I think he needs to see a doctor for him to be assessed.
Okay, so go ahead, see your diabetologist one more time, explain what you're going through, and that will be better because it's very hard for him to just say right now on the fly. But we'll wrap up with you as we go on a break on the prevention. As you were talking about, you've explained all the various cardiovascular diseases.
Yes, and therefore, again, from the beginning, we started saying 80% of cardiovascular disease are preventable. How are they preventable? Of course, we talked about the risk factors. But here maybe we should mention maybe one which we tend to forget. We are saying, of course, we have diseases which are due to infections, and we tend to forget infections. And I did mention a disease called rheumatic heart disease. These are diseases which affect children in primary school and when they're in high school because of poorly treated sore throat. So we want to make sure that our parents, our mothers, sore throats are equally important. Mm-hmm. Because you have a poorly managed sore throat, especially that sore throat which is caused by a certain bacteria, we call it streptococcus, it can lead to a heart disease. So infections need to be well managed so that you can prevent your heart disease. Mm-hmm. Of course, there are those diseases, all the other diseases which are related to lifestyles. We talked about the diet, exercise, that's how to manage your heart disease. We talked about the hypertension. If you have hypertension, you don't have heart disease. But at least you can prevent yourself from getting heart disease by managing your blood pressure properly. Okay. If you have diabetes, you don't have heart disease, but you can prevent heart disease by making sure your diabetes is well managed. Mm-hmm. So basically, preventing heart disease is managing these risk factors that we have talked about. That
is true. I think when I think about you, I'll be remembering the risk factors. Exactly. You said that so many times. Yes. I want to start that. With us in studio is Dr. Paul Njuguna, who is an endocrinologist, talking about diabetes, its relation to the heart, to cardiovascular diseases with Dr. Bernard Gitura. We'll be right back after this short break. Keep your questions coming, 22232. When we are back, we'll pick all your questions back to back as we respond to you. Remember, they've come here, they've given up their time, their energy right now, so take good advantage of that. This is Health Check. It's on Hope TV, where you look and live. Remember to share the link on Facebook. We're also live on YouTube, so share. Let the whole world learn and know about this. See you shortly.
Since late last year, the coronavirus COVID-19 has emerged as a serious healthcare threat. This is an infection that has gone global and no one has been spared. The government, through the Ministry of Health, has put in measures to keep Kenyans safe against COVID-19, which is currently rampant around the world, with new confirmed infections and death cases daily. Such sanitization and screening of visitors at this border post and across every entry point in the country is very vital in preventing the spread of the disease in the country.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive that you're thinking about stopping it at the border so that it does not spread.
It is scary that a single cough here can lead to an outbreak of epic proportions. In order to prevent that, the government has instituted measures to keep Kenyans safe.
The facility has all the equipments you need, from handling a basic patient up to ICU setting.
However, you also have a role to play in preventing spread of infections.
Citizen responsibility is the key to the success of this initiative and these measures. Let's all do what we have to do individually. And this is how we are going to defeat this disease.
It's just our general hygiene, okay? And that now means at workplaces, we should ensure that our work surfaces are clean.
Always ensure that nimefanya proper sanitation ya mikono. Every time na board matatu, lazima ni sanitize mikono.
We have faced many severe challenges as a nation, and we have always found a way to rise above them. COVID-19 is no different, and we will overcome the pandemic. Stop coronavirus. Follow all directives from the Ministry of Health. Wash your hands properly.
What comes to your mind when you think of the perfect home for your family? Is it the beauty, the comfort, the security, the convenience, or even the affordability? Victory Gardens offers exactly that and much more. It is just 10 minutes drive from Kitengela town and 3.8 kilometers off the tarmac. This gated community project comes with solar street lighting, maram roads, beautiful trees, 24-hour security, and water connected to every plot. The best part is, families are already living here. Call us today on 0702 831083 or visit www.optiven.co.ke.
Welcome back. I hope you're having a lovely evening and you're eating healthy. Today, more and more emphasis on our diets, on what we put into our mouths, on how it is we are active, proactively moving up and down. My serious dedication during this season is I have an option for a lift, but I've been deliberately taking the stairs, not only because of COVID, but because I just want to try and keep everything moving. So I don't know what you can do much more to make sure that you are active and that your diet is correct. Even as we talk about that, we have two guests in studio. We have with us Dr. Bernard Gitura, who's a cardiologist and also the head of the Cardiac Society of Kenya, giving us great conversations on diabetes and its relation to cardiovascular diseases. And to talk about diabetes and has given us an in-depth conversation on this is our Dr. Paul Njuguna, who's an endocrinologist. And even as we come back from the break, I'd love to ask our endocrinologist just to explain to someone who's watching for the first time, diabetes. What is diabetes?
Diabetes is condition. I emphasize condition because when you get toward diseases, then it becomes very like identity-like.
Yeah, so it's just a condition that you can manage and treat.
And you can live with comfortably in life. That usually, or no, mostly, it comes with when your sugar is high. And it's high when your fasting sugar is above 7. And the sugar after eating above 11. Usually, commonly, or the basic cause of diabetes is lack of insulin or inadequate insulin.
Okay.
By lack of insulin, that is in children. Inadequate insulin is in the adults.
Okay. Okello from Mombasa is already calling, but we'll get to you, Dr. Gitura. Good evening, Okello from Mombasa.
Okay, good evening.
Yes, thank you for calling. And what is your question?
My mom is diabetic.
Yes. We can hear you.
I'm from Mombasa.
Yes, sir, we can hear you. Your mom is a diabetic?
My mom is diabetic.
Mm-hmm.
She complains on the stomach problems and the knee pain. She complains on the stomach pain.
Mm-hmm.
Yeah, she complains on the stomach pain.
What is your question?
Yeah, stomach pain.
Mm-hmm. So are you asking if there's a relation?
Yeah, so I'm asking if there's any relationship between the diabetic and the stomach pains.
Okay.
Yeah, I need to see the relationship between this diabetic and the...
Okay. Doctor, do you have a follow-up question for him?
I didn't hear.
His mother is diabetic and she's been complaining about a lot of stomach pain.
Yeah.
All right.
So he's wondering if there's any relation between the diabetes and the pain.
Now, in the stomach, you will know what people are talking about is the abdomen, isn't it?
Yeah.
And there are many reasons that a diabetic person can have abdominal pains. One, if there is persistent kidney infection, which are pretty common in diabetic people, that can cause abdominal pains. Usually this is pain around the lumbar region and suprapubically. So the abdomen, I think one has to ask specifically, where is the pain? Is it lower abdomen or generalized abdominal pain?
Okay.
Of course, people who have had diabetes for a long time have other situations because of nerves, and they have persistent diarrhea. So there could be many other reasons. Could have gallstones, which are stones in the gallbladder. Again, a little bit high incidence in people with diabetes. So it's not a straightforward question and doesn't have a straightforward answer, especially if you don't know exactly where
the pain is. Maybe you could text us on 22232 and tell us where exactly the pain is, and also add some information on that, and then maybe the doctor can respond better. But also the advice is always to see a doctor, to see your dietitian. And also with us in studio, because I was still in the introduction, can my team help me hold the calls just so that we get through with this, is Dr. Bernard Gitura, who's a cardiologist, and you deal with matters of the heart. So no heartbreaks, just maybe pumping of blood, blood vessels.
Yes, of course, the heart, as we said, many diseases, many conditions. So we see a lot of patients coming with even worried. Some patients are anxious, they are worried, and as I said, the heart to be beating, so they come to us. Yes, we deal with the heart, yes, but still with a lot of other patients who don't have heart problem. We just need to reassure them. Yes.
That is true. So our cardiovascular diseases, we have explained them, and I think one that needs to be taken very seriously, that you have emphasized, and I'll repeat one more time, is the rheumatic disease, which could come through a sore throat. So take the sore throats very seriously. And when you mentioned the bacteria, I thought it's one of the things that we are vaccinated against, but you tell us about that. Let's pick a call from Kitale. Good evening. Hello, good evening, and thank you for calling.
Thank you.
Yes, who are we talking to?
We are talking to Gianni from Kitale.
From Kitale. Go ahead with your question.
Yes. About 4 years ago, I had gone to fit my glasses. Then as a routine, they took my BPs.
Okay.
Then my BPs were found to be way ahead, because it was 156 over 120.
56 over 120.
Yes. Which came to me as a surprise. And of course, after being repeated the checks, they indeed established that I was actually above the normal limit. So since that time, I've been put on the drugs.
Mm-hmm.
I take losartan and potassium,
Mm-hmm.
which is a diuretic,
Mm-hmm.
in combination with amlodipine, 5 mg.
Wow.
But my worry is that there is a continuous case of edema in my feet.
Okay.
It is persistent,
Mm-hmm.
so I don't know whether it is maybe a reaction to the drugs or whatever. Then recently, when I went for my clinic test,
Mm-hmm.
I was told to go and test for prostate cancer.
Wow.
So I do not know whether they are related
Mm-hmm.
or not.
Can I ask your age?
Sorry? My age? Okay, I'm 53. 53.
Sorry?
I'm 53.
53.
Yes.
Okay, so thank you so much. Let's just go through that information with the doctors. Dr. You've had it clearly. Could you break it down to us?
Thank you very much. I think that's a very important question.
Yes.
A lot of our patients are on treatment with medicine for hypertension,
Mm-hmm.
and then they experience leg swelling,
Mm-hmm.
like now in the collar. Yes, he did mention, I had him mentioning he is on a medicine called amlodipine,
Mm-hmm.
together with losartan. And amlodipine is known to cause leg swelling. So when you see leg swelling and you're on amlodipine, it's always good to discuss with your doctor, the doctor who you're seeing, so that the doctor can assess. And of course, there are other causes of leg swelling, including kidney diseases, including even the heart. But most likely, amlodipine may be the cause of his leg swelling, and I think you just need to share it with the doctor so that the doctor can get. We have a lot of other alternative medicines. The doctor can discuss and give him an alternative medicine. He talked about, of course, the need to test for a prostate cancer. But yes, again, I would like to reassure him, although yes, it's important to do a prostate tests. I think all men beyond 45,
Mm-hmm.
we encourage them to do prostate screening.
Mm-hmm.
But the leg swelling, I mean, at this stage, I don't really think it is the cause of his leg swelling.
Mm-hmm.
So I think let's encourage him to see your doctor, the doctor who is managing your blood pressure, and discuss that issue. But yes, amlodipine can be one of the causes of leg swelling.
Wow. Okay. Well, someone just called in and asked, as we were continuing, that the mom just got into a cold shower and collapsed and passed on. And that's really hard for us to be able to determine. But what could you comment about that? Because the person is watching and maybe just needs that consolation. And as you respond to that, can you get into this? What is insulin resistance and how can you manage it?
Insulin resistance, just to go back, one of the reasons that your pancreas from the beginning is unable to produce enough insulin,
Mm-hmm.
even before you get diabetes, is a situation we call insulin resistance.
Mm-hmm.
So in simple terms, insulin resistance, that the insulin you're producing is not enough for the needs of that body.
Okay.
Or the insulin you're taking. So there's that concept that in the initial stages, you get your body resists or does not respond well to insulin as it were before.
Mm-hmm.
It's like you have a lock that's got rusted and the key cannot open.
Mm-hmm.
So there's that struggle, and that makes the pancreas to try and attempt to produce a lot more insulin than it was before, and it gets tired and it starts getting weaker.
Mm-hmm.
So that's in the causing of diabetes. That's the insulin resistance. There's the other insulin resistance that happens in the life of a diabetic person, that become in situations whereby you have an infection, and when you have an infection, you get insulin resistance, your insulin requirements gets high. Other stressful events like a heart attack will cause some form of insulin resistance. Okay. And in terms of measurements, if you're using insulin and you're using more than, say, 200 units per day, you have insulin resistance. But there are all those stages that there is insulin resistance when you need to use more insulin than you were using before because of a certain thing that has happened to your body. You're going to surgery, and during surgery you need more insulin, and that is insulin resistant.
Okay. Josephat from Mombasa, good evening.
Yes, good evening. How are you?
I'm fine, thank you. Thank you for watching Health Check. What is your question?
Okay, my question is, I have my family. I have a family of 5, and there's 3 of them has got spots on their body.
3 of them have got
spots on their skin. They scratch, and then there's small spots on their skin.
Okay.
So it started about 3 weeks ago. But I don't know what it is. Can you advise me on what to do?
Okay, just could you kindly repeat your question slowly?
Okay, I have a family of 5.
Are you talking about your siblings or your children?
My children.
Okay.
As my wife.
Oh, your wife? Okay.
Yes, and so the wife and my 2 daughters.
Yes.
They have they scratch their bodies and their spots on the body that are scratching.
Okay. What part?
Yes.
Where?
Everywhere, all over.
All over. Okay. Okay.
So I think what it is.
Okay, that's interesting. So he's calling from Mombasa. His wife and his 2 daughters are having this really serious itch all over their body. And he's wondering what is happening to my family. I don't know how you can respond to that, as you also respond to the person that called in on the loss of their mother. Very sad.
Yeah, I think when you are listening, of course, to patients, it's very difficult all the time. Very difficult to be able to make a quick diagnosis just by symptoms. Like now, that one, of course, somebody itching all over the body. The first thing that we always think, is it a reaction? Is it some allergy of some sort? And therefore, very difficult to say. That is not heart disease, is not necessarily diabetes.
Yes.
So the first thing is always see the nearest doctor, because that doctor will need to see where are they itching, where is the itch, and be able to tackle it.
Yes.
So I would say the best thing, again, always see your nearest health provider. About the other situation,
Doctor, can I pick a question? You answer them together. Yes. Solomon in Kitale, in Kakamega.
Yes, Solomon in Kakamega.
How are you, sir?
I'm okay.
Please go ahead with your question.
Okay, I've had this problem of urinating for months, like more than normal.
Yes.
Like so many times in a day or in the night. And I've gone to the hospital. I've done blood sugar, the test. Everything is fine, but I'm losing weight and I'm urinating a lot, and the problem is not like ending.
Wow.
Yeah.
Okay. So thank you for that question. Let me just give it to you as you continue with that. Daktari, he's calling in. He's been tested for his blood sugar, but he's still urinating a lot all through. The problem is not ending, and he's also losing weight. And I had you mention all these symptoms, but you'll respond to that as we wrap up this one. Can I please have that control of the call, tafadhali, so that we can finish one thought as we continue? Yes, go on.
Yes, about the other somebody who mentioned that their relative was taking a cold shower and then suddenly died. That's very sad. I would like to share our condolences.
Yes.
Again, very difficult to say what was the cause. However, this sudden collapse and death, most of the time it tends to be either heart attack or is it stroke. Those are the 2 issues that I would imagine a patient who collapses and dies. And therefore, again, very difficult to say what it is. We always recommend a post-mortem, but yes, heart attack and stroke. If the patient had hypertension, I mean, those are the common causes.
Poleni sana. Daktari, what can you say to the young man? He seemed very young.
Has he been diagnosed to have diabetes?
No, he just did blood sugar tests and they came out normal.
And he's continuing to urinate.
He's continuing to urinate a lot during the day, during the night, and he's losing weight.
How old is he?
He didn't give us his age. Could you text us your age on 22232? I think now I'm learning the follow-up questions.
Yeah, because I think you can urinate sometimes very many times because you have other problems.
Yes.
One not so common, an unusual problem, uncommon problem, is when you cannot concentrate your urine because you have a problem of another hormone called ADH. either sensitivity or the way the kidney responds to it, or something in your brain, or something in the brain where it's being produced. So it's a little bit complicated, because if it's not going away, then I think his doctor must investigate further for other causes for increased urination.
So get a further investigation. If you could text us your age, it's good. We have 10 minutes to go, so keep your questions coming in on 20933. On 22232 right here. Can a UTI cause diabetes? If yes, once a UTI is treated, will the diabetes resolve? What is the risk? Thank you.
Diabetes does not cause UTI. No, UTI does not cause diabetes. However, people with diabetes have an increased likelihood of developing UTI because the urine has sugar and there's an overgrowth of bacteria around the urethra openings. So treatment of, and as a matter of fact, if you find somebody's sugar is not behaving very well, especially ladies, it's always important to check the urine for infection. And so once you treat the infection, you find they are much more easy to control their sugars.
Okay.
It's not the vice versa.
Okay.
Treat the urine well, then the diabetes management will be easier.
Okay. Okay, that's what we're doing. Even as you continue to call us, our call line is 0708 756396. We do have another line. You can call us on 0759 780 382. Our text line is 22232. We're continuing to take your questions. We've been talking about, first of all, avoiding cardiovascular disease, but people with diabetes, and we talked about this, being at very increased risk for cardiovascular disease. And I feel like all these are connected. Like, you get diabetes, it's just a boomerang. It's all round. And I feel that's what the conversation today has centered around. Let's just reiterate that one more time as we continue to do this. But I do have a caller, Joshua in Nakuru. Thank you for calling in.
Hello?
Hello, Joshua. How are you?
Fine, thank you.
Thank you for calling Hope TV. What is your question?
My question is this. I'm 75 years old.
75 years old?
70 years old.
Yes, sir.
And I had a stroke in 2006.
Okay, could you please reduce the volume of your TV because we can't hear you clearly? Okay. Aya, unaweza jaribu sasa?
I'm 70 years old.
Yes, sir.
And I'm a disabled person.
Mm-hmm.
And not a stroke on 206.
Okay.
My sugar always goes up.
Your sugar always goes up, okay?
Yes.
When you do what?
When I go for the test, sugar test.
Okay.
It's over 10.
Over 10. Okay. Have you been diagnosed with diabetes? You're diabetic?
Yes, I'm diabetic.
Okay. Okay. So what is your question?
My question is
just one more time?
Yeah.
Sorry, just ask that one more time.
I'm trying to buy this question.
Oh, your sugar level continue to go up. Okay. Okay. Thank you so much for calling, Joshua. Let's respond to that. Wow, I'm sorry. You know, kindly when you call us, reduce the volume of your TV because the feedback, it makes the call break, so we can't hear you very clearly. But the deciphering of the question is he's 75, diabetic. His sugar keeps going up to about 10. What can you do about that?
Well, I think the best thing is to discuss with the doctor, because there are a few things.
Yes.
Is the medicine he's using, is it working well?
Yes. And he is over 70. Thank you for watching.
Yeah, so he needs to see the doctor because the medicine needs to be evaluated, one.
Mm-hmm.
the cause for the sugar not to drop with the medicine, to rule out those infections, UTIs, another infection. He needs to look at his diet again. And it's very important that every time you find something like that, have a look at what you're eating. Are you following what you discussed with your doctor? Are you active enough, especially if you're 70, are you doing any physical activity? Because those helps also to bring down the sugar. And if those ones are okay and you're doing your best diet-wise and physical activity-wise, then one needs to look at the treatment and be adjusted. Because there's always a step ahead you can do to make sure your sugars improve. Yeah.
Okay, so get seen by the doctor, do all the above. We've talked about being active, we've talked about diet. Let's go back to our calls. Daktari's calls are coming now back to back. I told you at the end of the show. So let's just get this. Good evening, thank you for watching Health Check.
Hello.
Hello, how are you?
I'm fine. My name is Caleb.
Yes, where are you calling from?
I'm calling from Webuye.
Oh, Webuye. Thank you so much for watching. What is your question?
My question is to Daktari.
Which one?
What is the relationship between diabetes and nail infections? I'm actually a clinician.
Diabetes and?
Nail infections.
Nail, what infections?
Nail infection.
Nail.
Okay.
Like, I have a client that I'm managing, but the problem is the nails are always in some disorder. So I'm thinking of a fungal infection, but I've already tried fungal antibiotics. They are not working. So the client is like, what may be the problem then?
Okay.
I've been diagnosed with diabetes the other day.
Okay.
Yeah, another question is, does diabetes cause lack of sleep in most of these diabetic patients? Because they really cry a lot. They don't sleep. Maybe they sleep at 12, at 1. What's the relationship between diabetes and lack of sleep in these people?
Okay. Thank you so much for calling. Thank you for calling. We'll respond to those questions. Do you have a follow-up question?
Okay. No.
Give me the first question. First question was what? I had the pain and lack of sleep.
I'll get it for you just in a minute. Let's pick another call and then we'll go to those back to back. Good evening. Thank you for calling Health Check.
Good evening. You are talking to Kisuma?
Yes. From where?
From Thika.
Thika. Thank you for calling.
So I wanted to ask the Daktari about the CCF.
The what?
CCF.
Okay.
Congestive cardiovascular failure.
CCF.
Okay.
Yeah, my mother was diagnosed with it some time back. She has been on drugs. So I wanted to know whether she will continue to all those drugs throughout, because I was told that is the only way that it can be managed. And she has never been in any kind of alcohol. She was advised also to take the diet. And she takes the diet. So she has been all through on the drugs. I wanted to know whether she will take drugs throughout her life.
Okay.
Yes.
Okay, that's a good question. Thank you so much for watching, and we'll be responding to your question as we do that. Can we just hold the calls to pick these two answers, tafadhali? The first question was diabetes and nail pain and lack of sleep. What are those collaborations? And then we'll go to the next question.
Diabetes people generally have a higher, predilection to getting nail infections.
But nail, does it mean like nail?
Nail pain. What do you mean about this pain here?
Okay.
I think it may be extreme pains.
Okay.
Infection,
Okay.
It could be in the feet. Is it the feet? Because the toes.
Yes.
You have something we call peripheral neuropathy. That's quite painful, painful sometimes. That's one aspect. And that is common to people who have had diabetes for a long time under poor control. But there is medication that you can discuss with your doctors. Although there is another type of pain that you may get, and maybe Dr. Gutoro mentioned they call intermittent Raynaud's phenomenon. I don't know whether that's diabetes or much more complicated. When you put your hands in cold water, you get very painful nails. But the painful nails with diabetes, both toes and fingers, is something called neuropathy, and there is medicine, and you can use, and you can be able to sleep comfortably when discuss with your doctor, you get the medicine. It's there.
Okay. The person who called in was actually a clinician, and he's just really concerned about his patients. He said he was kind of treating them for fungi, fungal, and all that. Because
but if there was, because that's where I was going to.
Yes.
There is 2 types of infection you can get in nails. There's one that is painful and swollen, and sometimes there is oozing caused by a certain fungus called Candida. There's another one that nails just get damaged and they get finished, caused by another type of fungus, and they're treated differently.
Okay.
Again, it will be important if he's a clinician to take nail scrapings, and the nail scrapings are taken to a lab, and they'll be able to diagnose what type of fungus is causing the nails.
Okay. Thank you very much. Just saying that they're watching is my dad. Thanks for watching. He's saying I look better in natural hair. I wear wigs usually. Anyway, let's go to the question that the other caller asked.
Yes, about heart failure. I didn't mention heart failure is common, CCF. The question was, will the patient take medicines throughout their life? Normally in heart failure, yes, it is a chronic disease. These patients are supposed to take the medicines consistently.
Okay.
The one here is consistently,
yes, sir.
And follow-up is very important. So the heart disease, of course, they do respond to medicines, and they live a generally normal life. And if they are seen on follow-up, of course, we normally evaluate the heart every 3 to 6 months, doing what is called an echocardiogram, which will show whether the heart has gone back to normal.
Okay.
In many instances, yes, some patient can go to a completely normal heart, and once they go to a normal heart, of course, we discuss with our patient in terms of, yes, who need to continue medicine, because some of these reasons why they are on medicine is because the heart failure was due to hypertension. They have to continue medicine for hypertension. It might have been due to cholesterol or diabetic or even coronary artery disease. Some of these medicines, yes, they are withdrawn, but the other medicines which the patient has to continue because the risk factor do not disappear.
Okay.
If hypertension was the risk factor, it does not disappear. If cholesterol or diabetes was the risk factor, it does not disappear. But yes, the heart do go back to normal, but there are some medicines which of course can be withdrawn.
Okay.
So follow-up is very important, and that we evaluate how the heart has responded.
Okay. Yes, we talked about just continuing to manage the situation through and through. Gladys Kinangi just saying great information, saying thank you very much. A question from Maureen Wanyonyi saying sugars are at 20. Must you get insulin shots for a first diagnosis?
Well, that's an interesting question. Is that she a doctor?
Maureen Wanyonyi, I don't know, are you a doctor?
No, sugar's 20. There's something that we call, in diabetes, we call hit hard at the beginning.
Hit hard at the beginning?
Yes. Because what we have seen is that people who are treated aggressively in the beginning do much better.
Okay.
So there's no harm, because insulin will work immediately. You use tablets, they work slowly, maybe in a week's time. But when sugar is 20 or above 20, you are not sleeping well because you're urinating a lot. If you get your first shot of insulin, your sugars will go down, you sleep well that night, that week you'll be okay. There's your tablets. Pick up.
Okay.
So there's no harm.
Okay. Alice Alicia is just saying, hello, watching from Karen, ready to learn. I've been learning. Thank you so much. Caroline Siomiti as well, saying kudos, Daktaris, for all your enlightenment. Just saying thank you for that and much, much more. Keep your questions coming. We have about 3 minutes to wrap up this evening's episode. And as we've been talking about this, we'll keep reiterating on diet. The conversation is on diabetes, its relation to cardiovascular diseases, and there are so many diseases. Another person said they have high cholesterol. Should they take yogurt? I was trying to wonder what are the relation between that.
Yes, I think yes, cholesterol is managed both by medicine and through diet.
Yes.
So of course, we would encourage the choice of diet to try to reduce diet which has a lot of cholesterol, and of course we know milk has a lot of cholesterol, meat have a lot of cholesterol, even yogurt would have cholesterol or fat. But however, what I discuss with my patient, there's no harm in taking yogurt.
Okay.
The problem is how frequent and how much do you take.
Okay.
So every food that we eat is okay.
Moderation.
Moderation.
Yes.
So once you feel you miss yogurt, you can take it for that one day, as long as it's not your every other choice of the diet.
Okay, David from Athi River, thank you for calling. Good evening.
Good evening, too.
Yes, go ahead. What is your question?
My question to the diabetologist is that maybe a patient with a blood sugar of maybe 15 on the first diagnosis. Is it wise you start on those diabetic medications, or you can just do some watchful waiting as you try to emphasize more on the diet? Thank you for the program.
Okay, thank you so much. I think he's just responding one more time to hit hard at first, because he's talking about a patient with a 15, sugars of 15. Should they wait it out or get into diet first and then into other medication?
That's a very nice question, because many people ask that question.
Yes.
The sugars of 15, sugars of 12, whether they should be treated. And I said, I think in this day and age, we should discourage diet alone treatment.
Okay.
Because one, it doesn't work so well. It works, but it doesn't work so well.
Mm-hmm.
Two, it makes people complacent that they are managing it with diet. And they will live years before, and they actually stop going to the doctor again.
Mm-hmm.
So they will not know what their sugars are like.
Mm-hmm.
They will come back a few years down the line with complications. So from the outset, I think sugars of 15 are already to be too high to even contemplate on diet alone. You should be on treatment. But, and again, you see, I mentioned about target. You don't want to reach your target in 4 months' time. You want your target in 3-4 days' time.
That's true.
So you can't do that with diet and lifestyle within 3 days' time.
Mm-hmm.
Now, all that time before you reach your target by diet and physical activity, your eyes have been exposed to high sugar, your heart has been exposed to high sugar, your kidneys have been exposed to high sugar.
Wow.
So they have been affected.
Yeah.
So treat early and treat aggressively.
Early and aggressively. As we wrap up this one, tafadhali, our final caller, Bernard. Bernard in Kangemi.
Yes, this is Bernard from Kangemi.
Yes, sir. Thank you for calling. What's your question?
My question is, my mom has been hypertensive for the last 10 years.
Hypertensive for 10 years?
Yes, she has been all sorts of medicine, all hypertensive.
Mm-hmm.
And the pressure has seemed to be controlled.
Mm-hmm.
But the problem is she's always having a problem of swollen legs.
Swollen legs, okay.
And she was sent for some diagnostics.
Mm-hmm.
And like for the kidney, they seem to be all right.
Mm-hmm.
So I was trying to ask the doctors what would be the problem and why could be the leg swelling each and every other time. And she has got obvious palpitations now and again.
Okay. Okay.
Yeah.
Did you get that question, Dr. Ari?
Yes.
Okay, thank you. Even as we answer that, can we have the last call of the evening, who is a lady? Thank you so much for calling.
Hello.
Hello, how are you?
I'm good, thanks. My name is Modoni.
Modoni, where are you watching us from?
I'm watching you from Gong.
Thank you.
Yeah. So, first of all, thanks for the show.
Thank you for watching.
Yeah. I have two questions. One is I went through a very traumatic situation about 2 years ago, and it really affected my sleep. And to date, I still struggle with sleep. And then related to the same growth, is part of my question too, is like I would go to bed and then I find myself, I wake up and it's like I'm not breathing so hard, but it's like I feel I wake up stretching. You know, I'm sleeping, but it's like I'm stretching. What's that about?
Okay. Okay.
Yeah.
Thank you.
And then also, just to mention that we have cases of heart disease in the family.
Okay.
And I recently lost a brother, so I'm just curious about that.
Through what?
He died of a heart attack, and my father also died of a heart attack a few years back.
Okay. Okay, Paul Sana, and thank you for that history. At least a doctor can respond better. Dr. Ari, do you have a follow-up question? Dr. Bernard, do you have a follow-up question to our caller?
The response?
Do you have a follow-up question or? Okay,
no,
it's fine. It's okay. Even as you answer that, we're going to answer your questions now back to back. We can't pick any more calls. The calls are open like an hour ago. So thank you so much. As we wrap up, thank you so much for for those questions and the comments coming in on our text line. As we wrap this up, HCTZ drug. Who is that question to? It's to him. Okay, so HCTZ drug of choice in the DM/HTN patients. First line drugs of DM/HTN patients with truncal obesity. So you can respond to that. One answering, I have occasional stiff hands, unable to bend, lasts for minutes. Is it related to diabetes? Okay. And yeah, as you're winding up in 2 minutes, let's respond to those questions. We can start with you, then back to you, and then back to you.
Yes, there's the first caller who asked about leg swelling.
Yes.
A patient is diabetic for 10 years. Again, just as I mentioned earlier, a lot of causes for leg swelling. He said he has been evaluated for kidney disease and there was no kidney disease. So it's always look at the medicines that you are using. Are your medicine contributing to the leg swelling? Discuss that with the doctor, because we don't have the drug here, and of course the doctor who is managing him can be able to discuss that. Of course, the other leg swelling, there are people who have leg swelling because of what we call dependent edema, especially in women. Sometimes they are sitting for too long at workplaces. So you can have actually leg swelling, not due to heart disease or even kidney, but probably because of being dependent. So I think, again, the best thing, sharing with the clinicians who is seeing them to discuss these issues. And of course, if they are not being able to be helped, let them come to us. At least we can be able to maybe look at them and advise accordingly. The other lady, of course, I think there was issues to do with the sleeping and choking.
She had a very traumatic issue.
Yes, exactly, yes.
But also history of heart disease.
Yes. I do know if you're having challenges with sleep and you have had some traumatic issues, it's not unusual to have some social issues which would cause a lot of stress and anxiety, and they tend to worsen at night. And therefore, people can wake up feeling as if they are choking and as if they are not breathing properly. And again, because of the association with heart disease, again, just to reiterate the importance of sharing with the doctor, depending on whom she has seen. At this point, yes, it's possible that it's not heart disease, and therefore so that they don't panic. But at the same time, is it possible just to share that with a good clinicians or including us?
Okay.
About HCTZ, that is a medicine. It's a medicine. Of course, there are a lot of medicines which are chosen for hypertension, and I guess if somebody is using HCTZ, it's a cheap drug and is relatively effective, we still recommend that they continue. But if diabetes and HTN, there are certain medicines that we like them to be on. And of course, HCTZ, probably it is cheap, yes, but we don't like it to be the first choice in this diabetic who are going to use it for a very long time because it can cause sugar problem or cholesterol abnormalities. So the best drugs, of course, for DM and HTN, again, there are certain drugs that we would recommend.
Okay.
And again, this very good to discuss with the clinic recommending or who is managing these patients.
Thank you so much, Dr. As we wrap up this, you could just respond to the relation to the stiff remark. Thank you so much.
Stiff heart syndrome is common with diabetes, whereby they try and crunch the fingers is difficult, and sometimes when you succeed, it goes like this, then you call a finger, it goes twa.
Yeah.
Which basically is comes from nerve problems, diabetes neuropathy, and the tendons become stiff.
Yes.
So, and again, if you discuss with your doctors, I think you have treatment, whether there is some form of treatment.
Okay, thank you so much, Dr. I told you at the end of the show is when everything just comes pouring in. Maybe you could just give your closing remarks and then we wrap up this check. Remember to keep sharing the videos across all your social media platforms. Remember to keep interacting with us on Health Check. The repeats are right here tomorrow at 11 a.m. You're going to get a repeat of the show, and on YouTube you can continue to share. The show is Health Check. Asanteni sana. Just one more wrap up.
Mine, I'd like to thank Hope TV for remembering in the midst of all these crises that there are problems that will be here with us even when COVID goes away.
That's true.
Lest we forget that there is diabetes, hypertension, cancer, diarrhea, HIV, TB, all those diseases are with us. And we shouldn't forget, and our viewers should thank Hope TV for at least telling them
Thank you.
how to do COVID.
Thank you so much. And Dr. Bernard?
Thank you very much. Again, yes, I think it has been an exciting discussion. And mine, again, is just to remind our viewers, especially all those who are, if you have diabetes, you have hypertension, or you are living with a heart disease, ensure during this time of COVID, you are using your medicines. And if your medicines run out, please don't fear to go to the hospitals or discuss with your clinician so that you can upgrade, you can get a new prescription.
Thank
and
you.
If you have any acute problem, don't stay at home. The hospitals are still open and we are managing these patients.
Thank you so much. See you next week right here on Hope TV. God bless you. Next time when I say you stop giving calls, you stop.